According to the Strategic Planning and Communications Manager, Shalonda Prophet, the medical professionals at the Georgetown Public Hospital Corporation, Gphc, have taken on the additional responsibility of sanitizing and providing COVID-19 related assistance and preliminary testing to persons who venture to the health institution to access its free health care.
When you enter the hospital, you would have noticed that we've set up screening stations at our entrances. At our four main entrances, that is the two on New Market Street, South and North, New Market, Middle Street and East Street, we've set up screening centers where persons have to be screened before they enter the hospital compound. This is just a precautionary measure to ensure that when persons are coming into the compound, our medical staff can observe them and ensure that they don't have any signs or symptoms of COVID-19. It's basically an effort to protect our staff, our patients, and those who are visiting the compound.
Prophet reiterated that these measures are to ensure the safety of their staff, visitors, and vulnerable patients who are currently hospitalized. She appealed with persons venturing to access the services of the hospital to be honest when interrogated about their current health status by the health professionals. Persons that are showcasing the signs and symptoms of the disease or may have been exposed to the COVID-19 due to their travel history or otherwise are referred to the two COVID-19 triage centers before they could be allowed access to the hospital, Prophet explains.
If they are examined and they're suspected to be COVID-19 positive or have been exposed to COVID-19, our medical professionals at those triage centers will activate a care plan that allows them to be brought into the hospital in a way that doesn't affect other persons who are in the hospital. So it's just a precautionary measure to ensure that the hospital is safe. We have staff here who we need on the ground to take care of persons. We have patients who are in a vulnerable state of health, and so we need to ensure that we implement measures to keep them safe and keep them healthy.
She added that the Gphc doctors and nurses have been working overtime and the sanitization and cleaning efforts have been ramped up to stop the potential spread of the novel coronavirus. The Strategic Planning and Communications Manager maintains that the hospital staff is equipping themselves to deal with the possible increase of the cases and urged Guyanese to rest assured that they are fully prepared. She urged Guyanese to utilize the COVID-19 Health Emergency Operations Center before rushing to the Gphc and health centers in their vicinities.
Persons can call, and when they call what we call the Health Emergency Operations Center, they can advise them on what to do based on what conversation transpires between them and the person that they speak to. What I would advise people to do is to utilize those numbers. We don't know the state that that person might be in. I think the most important thing is for them to call the number and have the person who speaks to them advise them on where they can go, be it the health center or whether somebody will go to their home. It depends on where the person is and what their situation is. So I wouldn't advise people to go to the health centers or the hospital. Just call the hotline numbers, ask your questions, seek advice, and then wait.
Persons showcasing the signs and symptoms of the coronavirus can call the numbers seen here. For the HGP Nightly News, Amel Griffith.